Good evening. My name is Samantha Spruance, and I'm the interim head of the Pilot School, and I welcome you to the Pilot School's second parent workshop, Understanding Childhood Anxiety. It looks like we have a great group here, and it's so wonderful to see so many familiar faces, past colleagues, and new parents and participants. We will be holding a series of parent workshops over the next few months. The next one is on January 19th and will be about understanding mood symptoms in children and adolescents. For those of you who do not know Pilot School, I'll give you a brief overview. The Pilot School serves children age 4 to 14 who have a language-based learning differences such as dyslexia, ADHD, auditory processing challenges, and executive functioning disorder. Our students come to us needing a bit of extra help understanding how they learn. And at Pilot, they get the tools and guidance that they need to overcome their challenges. We provide a customized education tailored to each child's individual needs, and if needed, incorporate speech, occupational, physical, or music therapy into their school day. We work as a team, parent, teacher, and child, to develop an individualized program to fit the needs of each student. Our students leave us with a toolbox of skills and strategies to ensure their success at their next school. We have been so fortunate to have been able to be in person this fall. Our small class size, state-of-the-art facility, and 50-acre campus has allowed us to safely deliver in-person instruction. Our motto at Pilot is to unlock the potential of each children. Unfortunately, even before the pandemic, there has been a steady rise in childhood anxiety. And I don't need to tell you that the pandemic has only made it worse. Dr. Kami Winkelspecht, better known as Dr. Kami, is here to advise us on how to recognize symptoms of anxiety, different anxiety disorders, effective treatments, as well as the impact of COVID-19. Dr. Kami is a child clinical psychologist who works with children and families from preschool to high school. She is in private practice in North Wilmington at Child Psychology Solutions, and we are happy to have her as our presenter. I'm going to pass the screen over to Dr. Kami, but I do want to invite you to ask questions either through the chat room or the question and answer option. Dr. Kami can both answer questions during her session or at the end. We're also recording this presentation so you can revisit it at a later date at the Pilot School YouTube channel. Thank you again for joining us tonight.
And thank you so much, Samantha and Janet, for organizing, and again for I think helping Pilot to be a leader and really thinking about the emotional and mental health awareness, and also those supports for parents and your students. So I really appreciate the opportunity to work with you guys. And then again, to all the parents and families who have joined us tonight, thank you so much for taking time out of your busy schedule and sharing some time with us to kind of learn a little bit about anxiety. So like Samantha said, I'm happy to actually stop and answer questions throughout. So if something occurs to you, please put it in the question and answer or the comment box, and we'll be happy to stop and answer it then. We don't want to lose kind of that relevant question, and I'm sure if it's a question for you that it would benefit others as well. So I'm going to just share my screen real quick and we'll get started. All right, so everybody can see my screen? We're good? Awesome. All right, so our goal tonight is to really focus a little bit on understanding childhood anxiety. As Samantha said, childhood anxiety has been something that's increased in recent years, and we're going to talk through a few of the statistics about that today together. And I think it's really highlighted in a timely topic for us to be thinking about it now, as many of the challenges that kids were experiencing prior to COVID related to anxiety have kind of increased. And I think that COVID itself, as we'll kind of think about tonight, has had some increased challenges and brand new challenges for kids and families to worry about. So we'll think about that a little bit together. So our goals tonight and discussion topics are to understand anxiety and really kind of when to worry as a parent. So some anxiety is helpful, We know that anxiety is not necessarily something that's bad altogether. It serves a really helpful purpose when it's managed well. How has COVID impacted anxiety? And when does anxiety become problematic? And then some of the things to look for in differences between younger and older children. So younger and older children have different presentations of anxiety at times, and it can change within children as kids grow. How common are anxiety disorders in children? And that's when we'll talk about some of the data. So how common is it to have an anxiety disorder? Kind of what is an anxiety disorder? And what do we know about some of those statistics? Talk through a little bit of the differences between common anxiety disorders that kids could have, and what are the differences between those in terms of age or presentation or symptoms. Learn about effective treatment. So what does really effective treatment for anxiety look like? We know a lot about what treatment should look like for kids and what helps them to really overcome some of these fears. So anxiety is not something that has to continue to be problematic throughout your lifetime. They're really effective treatments. And I think it's really a good opportunity for us to think about some of those tonight. And then we'll think throughout this about ways that parents can help. So how can parents help to identify symptoms? How can parents help to coach anxious kids in different situations and kind of navigate through anxiety? As again, anxiety is something that's going to impact all kids at some point in time. So our first thought is anxiety always harmful? So the answer to that question is no. So anxiety is not always harmful. Moderate fear and anxiety can be appropriate and adaptive responses. So we know that it can help us in a lot of different situations. It can help to keep us safe. It can help to give us warnings about things. You hear about the fight or flight response, and that really is kind of your body's reaction to a stressful or a fearful situation that gives us a warning sign and a signal that we should act and we should do something to kind of get out of that situation or to respond. So we can't, even with effective treatment, you're never going to eliminate all of anxiety. We're all going to have anxiety that comes up at times. Our goal is to make sure that it doesn't prevent you from doing things that you need to do and isn't excessive. It's not harmful and it's not creating any harm. So being anxious when you start a new activity is really common. So most kids are going to be nervous when they're starting to try out for, let's say, a sports team, or they're starting to take music lessons for the first time, or they're starting to kind of go to somebody new's house, right, for kind of a play date. When we used to be able to do those things a little bit more freely pre-COVID. Being anxious before a test or a quiz can be really adaptive. So if you're a little bit worried about how you're going to do on the test or quiz, you're probably going to study a little bit more, and that's helpful to a certain extent. Being anxious before having a sleepover for the first time. So most kids are pretty nervous in that situation and nervous about being away from home for the night and what that's going to look like and having a lot of questions. And being nervous about doctor's visits. So kids are smart and they know that, right, doctor's visits can be a little unpredictable, right? Sometimes you get a shot and sometimes we have to get shots and nobody likes those. And so it makes sense that kids would be a little bit apprehensive and a little bit worried approaching some of those situations. And again, that's not necessarily harmful. So it helps kids to be prepared. It helps us as parents prepare them and answer questions and think about how that's going to go, and helps things to go as smoothly as they can. The overarching way that anxiety kind of affects us, and when it starts to kind of be harmful, is anxiety overestimates danger. So what happens in anxiety disorders is, and you'll see when we kind of talk about the types of anxiety disorders, is anxiety of some kind of danger. It's overestimating the likelihood that the worst possible outcome, or something really significant like death or severe injury, depending on the worry, is going to happen. So it makes it feel as if the fear will come true. And that's why you see a lot of these really intense responses from kids, because the fear is kind of telling them that this really unlikely thing is definitely going to happen. And so in these two examples that you see below, we have test anxiety. So in this example, a child might think to themselves, I'm going to fail this test. They might feel sweaty, have stomach aches, and then what happens is they go to the nurse's office during that math class to avoid taking the test. So what that tells them from an anxiety perspective is avoiding that got rid of that anxiety, right? They didn't have to worry about failing and their stomach ache went away. And very quickly, those patterns can then start to kind of reinforce themselves, where you'll see kids avoiding more situations because it does feel good in the short term, right? It does relieve that stress and that stomach ache to have avoided that test. What happens is it's a false sense of security. So it doesn't actually avoid that feeling in the future. It just gets rid of it for that moment. But that can be really powerful, especially for kids who don't necessarily know how often you're going to have math tests or how much you might have to be in that situation in the future. And the other example is spiders. So a lot of kids are afraid of spiders. Not that anybody necessarily loves them, but younger kids are often afraid of bugs and spiders. And so they see a spider and they think this has to be a black widow. It's definitely going to bite me. I'm going to die. They panic and then they immediately run away and avoid the situation. Thankfully, spiders, right, we don't encounter them all day, kind of every day. And so they're not necessarily as impairing sometimes as test anxiety or the other example that we talked about. But again, that same thing happens. So when you run away from the situation, you don't see the spider anymore, you don't deal with it. And what happens is the anxiety goes away. So pretty quickly, you get kind of trapped in a pattern of feeling really nervous, running away and avoiding the situation. And that pattern kind of repeats itself. Anxiety during COVID time. So COVID-19 has created some new worries for kids and families. And again, as we said kind of at the very beginning, that anxiety can actually be adaptive. So there's not something that's necessarily bad about being worried about some of these things. And it's actually pretty normative at this point to be concerned about some of the things that are on this list. So some anxiety about mask wearing is helpful to make sure that kids are doing it during the day. So Pilot was fortunate to be open in the fall, and having some worry about masks and making sure that kids are wearing them and talking about that as they're headed to school and making sure that they have them over their nose is really important because it helps them and it keeps safe and it helps other people to be safe as well. And I'm sure that they get that message, right, repeatedly in different situations. Some anxiety about being close to people that you don't know and you don't know where they've been. And, this 6 feet of distance can be helpful because it's going to increase some of those safety behaviors. Again, those are two things that I don't think that either, like me as a parent or as a psychologist, I never reinforced those things before, right? We never had to wear masks, and I don't remember having to be this conscious of distance, other than making sure everybody had personal space. So I think that both of those things have become really important and a part of kids' day-to-day lives that send them a message that there's something kind of scary out there that we're working to protect against. Worry about whether one might get COVID is really common. So it's why we have all these safety behaviors. It's why, our government and many other agencies are taking steps to make sure that we control the spread of the virus. And kids are going to hear that message because it could happen that somebody could be infected by this. Worries about whether kids are going to go back to school in person, right? So the switch from in-person to virtual learning and then hopefully back to in-person learning can be a worry for kids. How is that going to be different? How is the schedule going to look? When am I going to see my friends again? How am I going to make sure that I understand the work? Those are all really reasonable and adaptive worries to have in this situation. The last one I put on this list, but I've actually heard this one recently. So what will happen if Santa, right, is coming? Does he have to wear a mask? And is he going to be somebody that infects people? I'm obviously saying that to a parent group, but I think this is another fear that kids have because of a COVID situation. And again, just an unfamiliar world for them. So as we look at mask wearing here and kind of think about that as an example, the overarching fear is that you might get COVID and die, that kids are worried about that. And again, some part of that is really important to help them understand and kind of be aware of. So it might cause stomach aches, headaches at school, something that, again, there's a difference between home and school behavior. So at home, you might not have that feeling at all, and they might not have these symptoms because they're not in an environment that kind of triggers this worry and makes that fear really present for them. And they might be crying sometimes. And so then kind of an extreme response would be avoiding taking your mask off even for lunch so the kids aren't eating during the day. And we're not necessarily realizing that that's because of this worry about masks. And so it's really important to kind of think about how do we help to balance some of these fears, that yes, it's important to be mindful and to be compliant with these things, but how do we also help kids not to have an excessive worry to where it really prevents them from doing these kind of day-to-day activities like eating in this example. So as a parent, when should you worry about anxiety? So again, everybody feels a certain amount of anxiety and might even worry excessively at times. So if you worried over a weekend or a week about something and then you had this event and it didn't, it went fine, then it wouldn't necessarily be problematic. We're not talking about anxiety disorders happening within a week or a couple of day time period. So when anxiety is really impairing is what I really want kind of parents and educators and school professionals to think about. And impairing really means it's preventing you from being successful at something at home, at school, or in social situations, and it's gone on for some period of time. So it hasn't naturally gone away. It hasn't gotten better as you've kind of tried to do some of these, as you've gone to school kind of day after day, you're still experiencing some of these challenging, but it's really preventing them from being successful. So questions to consider: is it preventing success at school, home, or with other kids? Is it causing health difficulties? So sometimes, again, it can cause a lot of sleep trouble, and stomach issues are probably the two big things that are most associated with anxiety. Is the child not achieving to their potential due to their worry? So is test anxiety really preventing them from being able to show what they know on tests, and then they end up getting kind of worse grades? Is the child avoiding situations that create difficulty for them in the family, that you're just refusing to go to certain places or do certain activities? And it creates challenges that you can't do the things that you need to do as a family. And do you have to spend a lot of time thinking about worry and routines? Are you changing what you're doing? Are you modifying your day-to-day routine to avoid doing certain things to help the child to worry a little bit less? The more that anxiety starts to go on, you spend more time doing some of these things, and you make more accommodations to your day-to-day routine to help kids feel a little bit more relaxed. And again, those types of accommodations too can be really challenging over time as your world kind of gets a little bit smaller. So the more things that you accommodate and the more time that you spend doing those routines, it prevents you, right, from kind of doing the tasks that you really need to do to be successful as a kid. So let's think a little bit about what anxiety looks like. So some of the symptoms on this list, and as we go through these, I think you're also going to notice that these symptoms overlap with a lot of other things. And as we'll talk about a little later in the presentation, that it's pretty common to have anxiety along with another diagnosis. And you'll see from this list that it can be hard sometimes to kind of determine, is this anxiety or is this something else? Physical complaints. Oftentimes physical complaints are the first thing that kids mention and are kind of a warning sign of anxiety. Oftentimes panic attacks, so when kids might have a panic attack or teenagers have a panic attack, oftentimes referrals for panic attack or panic disorder come from emergency rooms, because the first time that it happens, it's truly very distressing, right? So it feels like your heart is racing and might explode, that you can't really breathe. And it feels like it's a really large medical event that's kind of happening. And so these physical complaints might start happening and kind of lead you to your pediatrician's office. Oftentimes pediatricians are also in the habit of trying to sort through, is this anxiety, or what part of this might be, you know, a medical concern that's kind of going alongside that as well. So frequent headaches, stomach aches, and body pains, you know, like your head hurts, your neck hurts, your back hurts, your foot hurts, like there are all these kind of aches and pains that are kind of coming up. And then being easily fatigued. So kids that are chronically stressed are tired easily. So they might be a little bit more likely to fall asleep a little bit earlier. They might say that they're tired. I know if my younger child said he was tired, I'd be pretty concerned that he would be ill, right? Because he's almost never tired. And so some of these things, again, are also really important as parents. It's really important for parents to be aware of this, because you're going to know when these things are not necessarily typical of your child, right? Some kids might always go to sleep a little bit earlier, but if that's not typical and your child doesn't experience these things, they can be warning signs of something different. Difficulty concentrating. That's obviously something that overlaps with attention disorders and concerns all the time. But the nature of anxiety is that you're over focusing on a worry, right? So you're thinking about how badly that you're going to do on that test versus just having difficulty concentrating on the material and having distractions in the environment. So it's really, what are you kind of dedicating your time to concentrating on? Excessive restlessness and fidgeting. So kids who are anxious oftentimes fidget. They move around a lot in their chair. They wring their hands a lot like this. They might pick at their nails. You might bite your fingernails. You could do all those things for different reasons too, right? Because you might have hyperactivity or be impulsive, but it's another thing to really be thinking about and kind of watching for from an anxiety perspective. Avoidance of certain situations. So kids saying like, nope, I don't have any interest in going to this place anymore. Nope, I don't have any interest in doing gymnastics anymore. I'm over that activity. What would have created that change, right? What would have made that a stressful situation? Panic symptoms, so heart racing, being flushed, an increase in body temperature, shallow, rapid breathing can be really distressing. A lot of younger kids have what I would call kind of mini panic attacks, where they have some of these things, but you usually get to them quicker or earlier because you're around younger kids a little bit more. And so you're able to kind of calm these so that they're not necessarily a full-blown panic attack. Whereas older kids will describe this whole process and kind of build up of all of these symptoms kind of happening at the same time for a lot longer. Persistent questioning about situations. So asking lots of questions about why are we doing this? When are we going to do that? When are we going to be done? When is it going to be time to do this? What's going to happen next? Can indicate that your child's really over-focusing and overthinking about something in an unhelpful way. Changes in behavior or interests. And this can really be, so younger children in particular, display a lot of anxiety through disruptive behavior. So arguing, increased tantrums, refusal to complete things when that's not necessarily something that they typically do. But there's that high irritability that happens oftentimes with anxiety that makes them a little edgy, a little, walking on eggshells and more likely to kind of argue with you. So that younger children in particular, again, don't have as many tools in their tool basket to really think about expressing these things in a positive way. So it can come out through some of these behaviors. Excessive aggression, but that's not necessarily, the most common. Significant increases in tension, stress, and irritability, right? That you're just seeing a difference in kind of their overall kind of stress level. And loss of interest in activities. I said gymnastics a minute ago, but that could go for any different situation. So all of a sudden they really like to be out playing with friends, hanging out. They were a pretty social kid. And now they don't really have any interest in doing some of those activities anymore. And that, again, is a big change for them. And again, not one of these things. So any one of these things in and of itself, probably aside from panic attack, would not make me think, oh, this is significantly an anxiety disorder in and of itself. It's oftentimes a combination of many different things on this list that would look like anxiety and might indicate that something like an anxiety disorder is going on. Developmental differences. So thinking about children kind of 3 to 8 versus children 10 plus. I know we have that gap year there of kind of 8 to 10, and that's a really interesting age range. So we'll talk about that more specifically. But younger children have a lot more focus on the physical symptoms on this list that we talked about. They have less ability to talk about their feelings, and so they don't have as detailed descriptions available to them about what they're feeling, kind of what that might be doing, and certainly not necessarily what they're thinking. So kids kind of 3 to 8, you could be the brightest kid on the block, so to speak, and you will not have the ability to do what's called metacognition. So metacognition is your ability to think about your own thinking in a way that changes it. So I could say, hey, I'm really having stress in math class because I'm worried that I'm going to fail the test. So the next time that I go into math class, I'm going to remember all the things that I did pretty well in math to prepare this test to help me be less worried. That's a very kind of cognitive strategy that younger kids just do not have the ability to do. They can't identify those thoughts in the same way that older kids can. It's one of the reasons that you'll see why questions not very productive for this age range. So why did you do that, or why were you worried about this? Oftentimes we'll get a, I don't know, because I truly don't know that kids really understand that they oftentimes have that really high kind of fearful, physiologic, intense response, and they kind of run away or avoid the situation. They don't necessarily have a lot of awareness over that thinking part. So insight-oriented strategies are not very effective at treating it for younger kids. Between 8 and 10, kids develop this ability to think about their own thinking. So metacognition develops somewhere between 8 and 10. And working with kids in this age range, I do a lot of anxiety treatment, and working with a lot of kids in this age range, it's really cool to see how this develops, that you can start to see how they start to kind of test out, well, is this true? And maybe I am a little bit better at math than I think. And they can really start to do a little bit more work on their thinking. So children 10 plus can have physical symptoms, but they might understand that they're related to anxiety. So they might say things like, I always have a stomach ache when I go over to my friend's house. Why is that happening to me? Or why might I be so worried every time I go into math class? Lots more talk about feelings, and I think they use the word stress a lot. So I don't oftentimes hear I'm anxious from this age group, or necessarily I'm worried. I hear the word stressed a lot. And so they might talk about their feelings or talk about the stress that they're experiencing. And metacognition has developed for this age range. So they can really think about their own thinking and help to change it. So it allows some more of those kind of cognitive or thinking strategies to be more effective in treatment. And in kind of talking with them about, what is the worry and how do they kind of rationalize about it. Common anxious situations for children. So these are just a few situations that children might be anxious about. Starting kindergarten, testing situations, starting a new school year, remote learning is certainly something I would put on this list now. Transitioning between kind of school years with new teachers. A lot of kids are worried about getting in trouble. What's going to happen if they get in trouble, or that they make a mistake, or that they don't want to make any mistakes because they want to be perfect. Before and after report cards, making new friends, sleepovers. As you see, this list kind of goes on and on, right? Bugs, weather fears are very common for younger kids. More in the summer, you don't actually hear a lot of worry about snowstorms. I know that we might have one of those this week, and usually kids are kind of excited about that kind of storm versus tornadoes or other weather events in the summer. Many people are really worried about speeches and presentations. So that's a skill that oftentimes results in a lot of stress, at least in those time periods that they're doing those activities. And then plays, concert programs, those types of things. All of these things I would expect to have kids be nervous about in some form or fashion or for some period of time, so that hopefully, again, they can talk about it and overcome it. So some tips for determining whether worry is excessive. So important questions for parents. As you're thinking about this list of symptoms and kind of the age of your child and some of these examples that we are kind of going over, I think if you can pay attention to some of these questions, and or you might have the answers to some of these questions already, it'll probably help you decide like whether this is something that might be a little bit more and we need some help to kind of address, or it's something that I think they're progressing and doing better on their own. So how long has this been going on? The question of duration of time, how long has it been going on? A couple of days, a couple of weeks, a couple of months, or has this been something that they've been worried about for longer than that? How much time do we spend worrying and planning about anxiety? And that question can actually be answered from a parent perspective alone. So parents, right, are oftentimes doing a lot of the planning, particularly for younger kids, if they know there are situations that they're going to be stressed about. They're spending a lot of time planning and figuring out how to work around a plan to make sure that they don't get too worried in these situations, or that they stay calm. Or how much are kids bringing it up to you? How much are kids kind of talking about it and thinking about it and asking questions about, you know, what the schedule is or what their plan is? Is my child able to do all the things they want to do in school and outside of school? Are they really able to make kind of their own choices about, I really want to participate in swimming, I really want to do this? And I know, again, in COVID, we don't have a lot of those activities. And so I think some of what we're seeing now is stress about participating in these activities again, right? So kids who really enjoy them, like, are we going to be able to do these things again? And can we do these things safely? It's a different type of question. Another way to think about it is, what is anxiety preventing you from doing? What's it preventing your child from doing? Or what's it preventing kind of you and your family from doing? And then who's in control? You can usually kind of think about like what predicts how the day is going to go, or what predicts, you know, the amount of time that you're going to spend on things. And is it the child because they are able to do these different things and you talk about homework and you move through your day pretty successfully? Or is it the anxiety that's really predicting and controlling a lot of the day? And again, if the answers to these questions might lead you to think about, okay, this might be something that we want to look into a little bit more, that we don't want anxiety to be the person who's in control in these situations. We want children and families to be in control of what activities that they do and how they move through the day. I'll stop here really quickly and just see if there have been any questions. Samantha or Janet, have there been any questions? I can't see them on my screen as I'm presenting.
Yeah, we do not have any questions yet.
Okay, great. Again, if there are questions, guys, please go ahead and send them in. No silly questions. So now let's think a little bit about how common anxiety disorders are in kids. So what do we know about anxiety disorders? We're really fortunate to have the CDC, which does an awesome job of recording and tracking a lot of data about mental health. They track many health factors, but they really do a nice job of thinking about children's mental health. And so in June 2020, the study that I'm going to go over kind of really surveyed kids 3 years to 17 years. The pandemic had been going on for a few months at that point. And here's what they came up with in terms of the base childhood mental health diagnoses. So about 9.4% of children were diagnosed with ADHD. 7.4% were diagnosed with other behavioral disorders. So that could be oppositional defiant disorder, right, conduct disorder, those types of things. 7.1% of children were diagnosed with anxiety disorder. So the third most common type of challenge to have from a mental health perspective as a child. And 3.2% of children were diagnosed with depression. Other facts of note from this report on childhood mental health, conditions listed above oftentimes occur together. And so what they found is that this is most common for kids who have a diagnosis of depression, that you might also have anxiety or you might also have ADHD. So it was more common for those to occur together for kids who had depression. But again, it's common, this idea of kind of comorbidity, you might have heard that word before. It basically means that two kind of diagnoses are occurring together and both impacting the child. Rates of mental health disorders increase with age for anxiety and depression. So the risk of having anxiety or depression goes up the older that you get in this age range. And then if we look at this graph, this is again from the CDC report as well. So depression, anxiety, and behavior disorders by age. So you can see kind of different peaks for different disorders. So depression certainly has the largest peak between 12 and 17. Anxiety also has its highest peak between 12 and 17, but you can see the difference in that middle age. So between the 6 and 11-year-olds, between depression and anxiety, that you start to have a lot more anxiety as you enter that middle childhood time as well. And then for behavior disorders, the highest time of kind of diagnosis would be in this 6 to 11-year-old, that middle childhood age range, and then it decreases as you get older. So common anxiety disorders in children. So thinking about the ones on this list, I'm going to kind of go through what they are and just a few specific features that kind of differentiate them and help you to kind of understand the difference between them and then other disorders on the list. So generalized anxiety disorder. Some people might say that that's actually the most common. Generalized anxiety disorder, I think sometimes also gets kind of a bad rap, so to speak, because it seems like you're just worried about everything in general, and it doesn't feel very specific. But oftentimes this is a category of anxiety that's used for kids who are worrying excessively about many different types of situations. So they might worry about social situations, they might worry about school and test anxiety, they might worry about weather and bugs, you might worry about separation and harm kind of coming to other people. So you might worry about a bunch of different categories on this list, and you're worrying about all of them kind of an equal amount, if that makes sense. There's not just one of them that seems to be dominant. And that you're spending a lot of time. So again, to have an anxiety disorder, you have to be spending a lot of time kind of thinking about these things, that it's really preventing you from being successful. And you're spending a good amount of time kind of thinking about this during the day or being worried about something. Separation anxiety is oftentimes more characteristic of younger children, although I would argue that homesickness in college is a form of separation anxiety probably. So most people haven't been away from home for that long a period of time before they go to college. And it's difficult, right, to kind of be away from home and wonder what's happening or, you know, what could be going on with people at home. So separation anxiety is really characterized. The reason that we see it in younger children so much is that younger children spend a lot of time with their parents before they go to preschool or before they go to kindergarten. And so they're not used to being away from parents for really that much of a period of time. And so we see kids being worried about being separated from parents, being worried that something bad would happen to them or would happen to a parent. As kids get a little bit older, separation anxiety is also characterized a little bit more by worries about harm or death kind of happening to caregivers. So as you're separated from them, is something bad going to happen when you're separated from them? And they would worry about those things. Again, younger kids can't focus as much on some of those thoughts, whereas older kids kind of in that 8 to 10 range start to think about like, well, what happens to, you know, your family members when you're not with them? Social anxiety disorder is really characterized by a fear of different social situations and more exclusively, like, what are people thinking about you and what's their impression of you? So how are people evaluating you and judging you and kind of thinking about you in these social situations? What's others' perceptions of you? And that prevents you from then wanting to be in social situations because you're really worried about how other people are kind of thinking about you, how you're coming across to other people. But it's really exclusively focused around those social interactions. Obsessive compulsive disorder, OCD. So OCD can definitely happen in children. It happens less commonly than some of the other anxiety disorders on this list. You don't actually have to have obsessions and compulsions to have OCD. So you could have just kind of obsessive thoughts, which is a really over-focused worry about contamination, about safety, something like that. Or you could just have compulsive behavior, meaning that you're doing something repetitively to keep yourself from kind of worrying about something. Most commonly, they occur together. So you're going to have obsessions and compulsions happen together. The unique part about OCD is that compulsions are meant to kind of get rid of this worry. It's a unique way that your body's trying to kind of compensate for this worry. So I'm really worried about safety. So I'm going to make sure that I wash my hands 5, 6, 7 times a day. And those compulsions are meant to kind of get rid of the worry and say that I'm not going to be as worried about safety. But what we know about OCD is that it doesn't work, right? So they're not kind of connected back together. And so these compulsions never get rid of the worry. And so it's kind of a vicious cycle that happens. Oh, Janet, I'll pause. It looks like there are a couple questions.
Yeah, I'm sorry, there is
Great.
a question. I was just getting permission to read one of them
Sure.
out loud. So let me see if she's answering. All right, let me come back to that one and see if there's
Sure.
another one. Okay, so I'm going to read this question and then let you handle it. So the question is, my husband died 5 years ago.
Okay.
My daughter was 7 at the time. The night before he passed away, they had a huge fight and he told her that she makes his heart hurt. He passed away 12 hours later of a massive heart attack. She still blames herself for his death. Anytime I leave the house, she pleads with me not to die. What can I do to help ease her anxiety besides telling her what I can control? You know, eat well, I exercise, I wear my seatbelt, I don't text and drive. She's asking, is there anything else she can do to sort of put her daughter's mind at ease?
Sure. So first, thank you so much for sharing the question. And I'm so sorry that that's a situation that happened to your daughter and to yourself and your family. I think as we're thinking through kind of what are parent strategies, it sounds like you've actually done a lot. And so I think all the things that we're all talking about tonight, I think are really helpful for kind of education and kind of learning a little bit more about anxiety, but they're not necessarily replacement for treatment. So all of the information that we're talking about today isn't necessarily treatment for anxiety. So it sounds like that you've done a lot of those things that would be really helpful to try and help provide reassurance and help to provide support to get over the fear, but it sounds like it's not necessarily helping. And so I think that could be, as we're kind of talking a little bit more today about like what then kind of characterizes anxiety that might benefit from some therapy support, I think that's something that could fall into that category. Again, I don't know your child or family, but it sounds like you've done a lot of these strategies, hoping that they've been helpful, but they haven't necessarily resulted in change in the anxiety. So it might be helpful, right, to get some support related to that. Because again, our goal tonight is not necessarily to, provide treatment or kind of a substitute for treatment, but help with that education. So thank you so much for asking that question.
That's all I have right now.
Okay. So thinking again, we talked a little bit about obsessive compulsive disorder. So it's a unique worry in that these behaviors are kind of related to the worry and they develop because of the worry, but they don't necessarily make the worry go away. So it's a particular type of treatment that you have to do with OCD to kind of get that to go away. Specific phobias. So that's a really focused fear about something in particular, so that you would have one fear, like weather is one. So weather phobias are more common in kids. Bug phobias are more common in kids. You also might have like blood injection, like needle phobia that could happen as well. Dental fears, those types of things happen as well. And again, what characterizes a phobia is that the fear is far in excess of what would be typical, right? I mean, nobody really likes to get a shot, right? I don't know any kid that would be excited to get a flu shot. But does it prevent them from being able to stay in the room and to ever get the flu shot and to be able to be coached through these experiences? That's the type of kind of worry we're talking about for anxiety disorders. And then panic disorder. So that requires having a panic attack. So some of those symptoms that we kind of talked about. But also then the fear of having another one. So with panic attacks, sometimes you can also have claustrophobia, where you're avoiding being in situations progressively because you're worried about having one of those panic attacks again in the future. So again, this is just a sample of some of them. But again, these are what would differentiate them. And so how do you kind of start to think about those and the types of worries that kids are having so that you can, again, talk to a pediatrician or a mental health professional if you feel like it would be helpful. So how many kids receive treatment? So we saw from that CDC study a little while ago, the percentages of kids who have anxiety disorders or have these mental health conditions. And so what also they looked at in this study was how often do they receive treatment? So of children who receive mental health diagnoses, 8 in 10 children who were diagnosed with depression did receive treatment. About 6 out of 10 children who were diagnosed with anxiety disorders received treatment. And 5 out of 10 who were diagnosed with behavior disorders received treatment. So what does this tell us? One, so it tells us that not everybody, right, who has an anxiety disorder gets treatment. And this wasn't necessarily effective treatment, but would be engaged in treatment. So I think it also tells us that it can be hard to identify signs and symptoms of mental health disorders. It can be hard to figure out, like, when is the time to be concerned or when do we seek treatment? It's hard to know when to seek treatment, right? When is this going on enough, or when has kind of the worry gotten so excessive that it's preventing you from being successful? Access to treatment can also be challenging. So barriers to care can be substantial. And so navigating kind of the system to figure out how do you make an appointment, is it the right person, is it effective treatment, all of those things, health insurance and all of those things can make it very challenging to receive treatment. And also I think workshops like this are really important. So again, as we talked, our goal today is to provide a lot of this education and to open up the line of dialogue and conversation about it, because it helps everybody to understand a little bit more about how do we think about how to support children and how do we support mental health a little bit better. So I think workshops like this are really important to kind of reduce some of those barriers and help kind of parents understand what can they do with some of these situations that kids are presenting and symptoms. So what's effective treatment for childhood anxiety? We actually know a lot about it. So childhood anxiety has been studied a lot, and we know a lot about what works and what doesn't necessarily work. So there's strong evidence to support that cognitive behavioral therapy, or CBT, should be a first-line treatment, as CBT doesn't pose any risk that like medication treatments would be. So it's a talk therapy, essentially. It's a kind of talk therapy. And we'll talk a little bit more about what CBT is in a minute. But that should be the first line treatment, that if a child's not been engaged in treatment, that this should be a reasonable kind of first step. Treatment with the medication, again, I'm not a physician, right? So I'm not recommending medication as an option, but I wouldn't be doing my job well if I didn't say that it's also a viable choice for kids who are unable to engage in CBT. So if you aren't able to engage in CBT, if you can't necessarily show a lot of improvements through engaging in the intervention, then medication could also be a helpful option. And medication treatments would be with SSRIs, so those are the most common category of medications. And what we know is that it's most effective when it's combined with cognitive behavioral therapy. So standalone medication management treatment is not as effective as if we combine this with cognitive behavioral therapy. So what is CBT?
Dr. Kami?
Oh, sure, yes.
Can I just interrupt? We do have a question from someone asking for suggestions for introducing treatment for a person who is resistant to going to treatment.
Yeah, so that's a really good question. So what to do if you feel like your child needs treatment, it sounds like is the question, but they might, or your child, or right, somebody, a significant other might need treatment, but they're not necessarily open to it. I think part of the stress about kind of breaking down this treatment barrier, and again, I'm really happy you asked the question, because I think helping kids to be comfortable and families to be comfortable accessing treatment and know that it can work and it can be helpful is really important. So I think sometimes, let's say therapy gets kind of a bad rap, so to speak, that you'd be kind of engaged in treatment for a really long period of time to see change or results. And what we know is that cognitive behavioral therapy is really effective and can be really effective in as little as 4 to 6 sessions. Some people even start seeing benefits after the first couple of sessions. Also helping them to understand what is kind of a therapy process. And so it can feel a little bit strange to say that you're going to meet with somebody new, right, who's going to help your family, and they're going to tell them about all the things that you're worried about. And so I think helping kids to understand that it can be a stressful process to kind of think about getting treatment, but that keeping these worries inside isn't necessarily working and helping either. And so that a psychologist or another mental health professional is somebody who's really trained to understand a lot of worries that affect children and know what to do when parents have tried all the things that they can do and kids have tried all the things that they can do to get it to improve, and they just need a little bit of help. And oftentimes it's learning just a couple of strategies that can be really helpful to get them to be back in control of their life and kind of what they want to do and making those choices, and that anxiety isn't necessarily controlling that. And I think helping them to just see like what that is, right? It's not that kids have to also be on their own. If they're more comfortable sitting with a parent and talking through those things, if they want their parent to participate 100% of the time, that kids and parents should help to really dictate kind of what that agenda is and what kids are going to be comfortable with. And so helping kids to understand that they can, parents can be present, that you're not going to be alone with somebody, that's a stranger, that again, most professionals like myself want to make sure that kids and families are really comfortable and that they talk about these things in a way that's going to help them to feel like they can move forward and find some strategies to help this kind of anxiety not really affect their lives anymore. So sometimes just giving some of that information and also kind of normalizing the process that everybody finds the first session, I think, a little bit challenging because it's a little weird, right? To meet with somebody that you don't know and tell them about all these things that you're kind of worried about. But it's the first step at being able to really help to kind of take back control over the things that you want to do and to feel less stressed and kind of more comfortable and more relaxed again. So great question.
Yeah, there's a follow-up to that.
Sure.
Basically, it's saying the person feels that treatment is an acknowledgement that something is wrong with them. And so I guess how to overcome that.
Gotcha. Okay. So that acknowledging that you would need treatment would somehow say that something was wrong, or that you're kind of doing something wrong, or that you're doing something, not very effectively. And I think I would encourage you to kind of think about the fact that to kind of talk about it in the way that everybody kind of needs help with something, right? And so oftentimes I'll ask parents when I have conversations about kind of setting up first visits, if kids are a little bit hesitant, to think about, what's a time when a parent might have needed help with something and had to kind of ask for some support or ask for help about something. And so this doesn't necessarily mean that there's something wrong or that you're doing something bad, but sometimes you just need a little bit of help to figure out what's the best solution. And it doesn't mean that anything that you're doing is wrong or that, you're doing something that's making it worse. It's just that you need a little bit of help to figure out how can you make this situation a little bit better. And if you've tried all the things that you can do, then it's helpful to kind of talk with somebody else just to see if they have any other ideas. And that might be a way to kind of I think kind of help them be a little bit more relaxed or kind of de-stress about that situation. That the goal is not to find a label or something that's going wrong. It's to figure out how can we help to use kind of the things that you are doing well to help you figure out this kind of unique problem and a different solution. So great question. Thank you for asking. So what is cognitive behavioral therapy? What is CBT? So we know it's the most effective treatment. So what should really happen in a CBT session? I feel really strongly about giving education directly to parents and children who are the consumers of mental health services about what really good care should look like. And so the process of CBT is essentially boiling down to these three things. So you've got thoughts, feelings, and behaviors. And you see the arrows connecting everything together. So what we know in cognitive behavioral therapy is that your thoughts and what you're thinking in a situation drives what you're feeling and what you're doing. What happens a lot of times is that kids, in particular, kind of kids and adolescents, can feel like a big feeling. So there's a huge feeling that's happening that they might be able to identify. And kind of what it does. What does it create in terms of the stress, right? So you might feel really sick to your stomach and worried, and then you run out of the situation or you avoid doing something. But the thought part is really what's kind of driving that. So there's always a thought process that's behind that, that's saying, I'm not going to be successful, or, therapy might not work for me, or they might think that something, using the example about therapy even, right? That you feel really uncomfortable about starting therapy. And that's causing you to avoid therapy because you're really worried about being labeled, right, as having a disorder, and that means that something bad's happening. But what really happens as a part of therapy, or is that something that's really going on? You don't know, right? So it's kind of confronting that process and figuring out what is that thought and how is that creating the feeling and causing you to do something that's probably not as helpful. So CBT in a nutshell helps parents and kids to identify what is this fear. And again, we're talking about this for anxiety specifically. So for anxiety treatment, you're thinking about what's the fear, or what's the worry, or what's the stress, or what's that kind of situation that's really creating all of the stress. You really then want to understand and identify what are those emotions, or that could be the physical signs. So the stomach aches, the headaches, the sadness, the crying, the tension, those types of things. What is it creating? So what's this kind of fear creating and causing you to do? And then what are you ending up doing? So because you feel that uncomfortable in the situation, you have crying and stomach aches or headaches, then what are you doing to kind of deal with that and to kind of get rid of the stomach ache? And a lot of times, again, with anxiety, that's avoiding people, places, situations, things that kind of trigger this anxiety. And so when you avoid it, it takes away that stomach ache, but it kind of only takes it away for the short period of time. And so your mind is kind of tricking you to think about it. Getting out of that situation is really going to work. But what we know is it's not necessarily going to work because you have to be in that situation again pretty soon. Trying something new, so figuring out how to face this fear and show that this outcome is not really likely to happen, right? So if you're going to be kind of close to a spider and you're going to see that it's not going to jump towards you and bite you. So at some point to get over the fear of spiders, you have to be really close to a spider, right? You have to face that fear to see that what you're really worried about and that you're going to die is actually not going to happen. And so this behavior part that's kind of in the bottom left-hand corner is really important. So therapy is not cognitive behavioral therapy unless you try to do something new and face the fear. It's something that's called exposures. So you have to do exposures. You have to be in a situation that you're nervous about. You have to be in a situation that you're worried about and try doing something different to kind of get over this fear, that you have to face that fear to really learn that it's not necessarily going to happen, right? You have to really confront that fear. And so you cannot call something a cognitive behavioral therapy intervention unless you're trying new skills and strategies to kind of face this fear. That doesn't happen, the first time necessarily, right? I mean, sometimes it could, but an intervention is not cognitive behavioral therapy unless you're trying to kind of break down these fears and approach it and figure out how do we kind of confront this fear and face it and try something new. You do less of this thinking work, as we talked about a little before, the cognitive part of cognitive behavioral therapy. You do less of that thought work for younger children, particularly between 3 and 8. There's not a lot of that cognitive work and trying to figure out why this situation is bothering them and, having them really try and break it down and think about their perspective or their evidence. You don't do that as much with younger children because they just can't do that level of work. You do a lot of work with parents for the younger age group. So helping them to identify what some of those thoughts might be, but deal with the feelings and the behaviors and trying something new. Rewards for trying something new is really important. So getting over fears and having an anxiety disorder is really difficult. So these are honest feelings and honest worries that kids have. And it results in a lot of physiologic distress and crying and sadness and upset. And so giving them rewards for practicing trying something different, right? For getting close to, right, a situation where a spider is going to be and approaching that and doing that step by step by step. And again, providing those rewards can increase that motivation a little bit to help kids take the steps that are going to be a little bit more helpful. So rewards are something that's really important for kids when we're kind of thinking about CBT. Obviously, they look different for younger children than older children. And you rely a lot more on rewards for younger children because, again, parents are doing a lot of that coaching work. The kids aren't necessarily able to do all that work themselves. So how does kind of CBT work? So let's take that fear that we had of the math test at the beginning. And I'm just picking on math, right? You could substitute any class in here. So I apologize, right, if anybody is a math teacher. I'm not unnecessarily picking on math, but I'm going to fail. So that thought part that the kids may or may not be aware of is that you're going to fail. They're worried about making a mistake. And they feel that stomach ache and that sweaty feeling. So they go to the nurse's office during math class and you avoid it. So what would happen, over the course of time in a cognitive behavioral intervention is that you would work to kind of replace this thought. So that fear that's saying, I'm going to fail, you're going to really think about, what do we know about this? Let's say that this is a 10-year-old kid. Well, what do we really know about how well you can do at math? Most of the time you get grades that are pretty good, right? And most of the time you understand the material that's on the test. You do pretty well on the homework. So we can replace that thought that I'm going to fail with, I usually do okay on math tests. And when we replace that thought and we shift it and we challenge that fear a little bit, then we see that you get a little bit less nervous. So you might still be nervous taking a math test, but you're not going to be quite as nervous as when you were really afraid that you were going to fail. And so what you're going to do in that situation is you're going to coach yourself to take that test. So it's, I can do this if I can stay calm. I can take the test. You take the test and you see that your grade is okay. So essentially you're disproving that fear, right? So you're showing yourself by approaching the situation and facing the fear that I can do this, right? I can do okay on these tests. And the more that you practice it and face that fear over time, the more math tests that you take, so to speak, in this example, the better that you're going to feel. And this nervous feeling is going to go away, right? Again, it might not go away entirely. So you might be a little nervous taking tests because that helps you to study a little bit more, and that might be adaptive, but we don't want you to be so worried that you can't take it, right? And that you're having stomach aches and having almost panic attacks because you're in that situation. So a note about parent coaching. So as we're thinking about kind of what can parents do in these situations, I think really understanding some of the treatment parts, so kind of demystifying, so to speak, what is cognitive behavioral therapy, and helping parents see that they can really do some parts of this pretty actively at home. Because again, not everything is an anxiety disorder that needs its own kind of therapy intervention. But facing your fears. So we want kids to get the message that facing fears is okay, and it's a part of life. All of us have to do things that we're nervous and scared about at times. I encourage parents to model this for kids, right? So what was the time that you were really nervous or worried about something and you had to work through it? You had to figure out, what am I going to do to be a little bit more successful and kind of get over that situation? So having that mantra of facing fears. So helping kids figure out, again, how to approach those situations. So fearful tasks or really difficult tasks instead of avoiding it. You can break down almost any task into smaller parts. And or you can identify what supports can you provide that'll help them be a little bit braver. So let's say that they would like to be able to stay at a friend's house for a play date kind of on their own. Let's take that as an example. You might be able to stay at a park together, and then you leave for a few minutes and then kind of come back. So that's a shorter period of time. You might then leave for 30 minutes and then kind of come back, and then they could stay for maybe a full play date. So those might be 3 or 4 steps that you would do to help support them, but help them feel a little bit more brave at taking those first steps to being a little bit more independent, again, if that's appropriate for their age. Having kids identify times that they were successful. So everybody has been successful at facing fears. Again, we're worried and nervous about things a lot of the time, and we do them and we get through them and we're successful. It's just how big are these fears, right? And do they keep us from doing it? So having kids really think about, what are times that they were successful at facing a fear or doing something really tough that they thought, hey, this is going to be really hard to do, and I really kind of want to get out of the situation. Help them really think about some of those examples. Again, share those times from you. You can have, if you have siblings that are older, siblings are really helpful to sometimes help kids say, oh yeah, right, your tests do get a little bit harder as you get old, and here's some strategies that you can use. And relate those things that they have been successful with to what's this new fear. So because you did it in this situation, you're super brave. I think that's kind of similar to how it might work in this situation. So how could we try this? How could we work together to kind of get you over this fear? Knowing also that it gets easier each time. So the more that you approach situations that kids are fearful and you're providing the support to them, it gets a little bit easier every time. So as kids have experienced facing fears, and help them see this benefit of their effort. So if they are facing this fear and they're in the situation, then we want to do what I call kind of therapeutically connecting the loop. We want to connect this back to, like, let's say that they went to the park with their friend and they stayed for 15 minutes on their own. I want them to connect that back to, hey, you were super brave today at staying with your friend while I was gone for a few minutes right down the block. Great job, right? That tells me that you can do a great job whether I'm there or not, and maybe you can do it a little bit more, right? So you were worried that I wouldn't come back or that it would be too scary, but you did it today. Right? So those worries maybe aren't as big of a deal as we think. So you want them to learn from the experience. If they're facing the fear, we want them to learn that this kind of proves or shows that this worry isn't necessarily so big or so overwhelming. Providing rewards for bravery. Bravery rewards are really important. So if you see them taking on a difficult task, if you see them doing something new that they were a little bit apprehensive about or nervous about, really providing that reward and praise. A reward could be praise, a reward could be a small token of something that you're really showing them to kind of highlight, say, hey, I really appreciate the extra effort that you put into here. And that can help them do the same thing again in the future. Using rating scales to help kids communicate about fears can be really helpful. So as you're sorting through, like, is this kind of a bigger fear, or how worried are they about it, or how do they feel like they might be able to approach it? Using rating scales. So my kids would tell you that I use rating scales for things all the time. My daughter says, oh no, is this a scaling question? So I love scaling questions, right? It helps us to understand how big of a deal is this. So if, let's say that they're worried about going back to school after the holiday break, right? Or returning from kind of remote learning. How hard is it going to be to go back to school? On a scale of 1 to 5, I use 1 to 5 for younger kids and 1 to 10 for older kids. 10 is the most worried and stressed that you could be. One is you're totally chill, right, and relaxed. So how big of a deal, how much is this going to stress you out to go back to school? And then they can give you a number to give you some idea or way to kind of communicate about how intense the fear is or how hard they think the task is. Again, we might think that those tasks are pretty easy, but anxiety is one of those things that's really in the eye of the beholder. So kids are going to have to help us understand what they're thinking and feeling a little bit more before we can kind of help them the most. And then also learning kind of what would make it easier. So if it's a 5, how can we make it a 3, or how can we make it a 2? You know, what questions do you have, or what support can I provide for you? So these types of things from a parent perspective, again, whether you're in anxiety treatment or not, are really effective ways that you're helping kids to kind of face these fears and start to be brave and kind of conquer some of their anxiety provoking situations. Just a few references and resources. So to learn more about the CDC report, it had actually a number of other facts and interesting kind of tidbits in there as well. That reference is here for your benefit. If you want to learn more about effective treatment and childhood anxiety, there are 3 resources here that are all equally good. So Effective Child Therapy is run by a sub-organization of the American Psychological Association that's dedicated to children and adolescents. And so it'll tell you actually all about anxiety disorders, the types of treatment. It actually even gives you assessment tools that you can use that are free and available, that are score measures about anxiety or depression, and help you to have kind of a conversation with your pediatrician or with a psychologist or other mental health professional to say, here's kind of what my child's having, and here's kind of how I learned a little bit more about it. So that first website is incredibly helpful. It'll give you all those tools from kind of A to Z. AnxietyBC.org is just an awesome resource for thinking about educational resources and learning more about all these different types of anxiety. Again, for adults and children is that one. And then Help Your Kiki is actually a public resource developed by the state of Hawaii. Kiki is the Hawaiian word for child. It has a lot of awesome resources that are very similar to Effective Child Therapy or AnxietyBC.org. And then 2 book recommendations, Helping Your Anxious Child and Talking Back to OCD. So these are 2 of, there are many, many anxiety disorder books that you can have. These are the 2 that I own about these 2 topics, because I think they're really straightforward and are aimed at helping parents to figure out how do they help support their children more effectively. All right, so questions, thoughts? Any other questions that have kind of come up or topics that might be of interest to discuss with the group?
Nothing right now.
No?
No.
Okay.
Should we just wait 1 more minute?
Sure, we can certainly do that. And again, I think COVID has kind of put us all in a time where we're thinking about all of these kind of like worries and stressors a little bit more, right? Uncertainty is something that's really challenging from an anxiety perspective. And so I think we're encountering a lot more of those transitions and challenges, and again, things that can kind of make kids and parents both a little anxious and overwhelmed sometimes. So I think it's a tough time, but a timely topic for us to be thinking about this.
Oh, wait, I think I have a question. Hold on.
Sure.
How long should someone wait for CBT to work before considering another method of treatment?
That's a really good question. I think I would think about that in 2 ways. So first, I would want to have a sense of what are the kind of the cognitive behavioral strategies that you've tried. And so this would involve a conversation with your child and the therapist, or the therapist on their own, to say, you know, what have we tried in terms of cognitive behavioral strategies, and, you know, how has my child really responded to those? So I think having a good conversation about what I would say is response to intervention. So how has this intervention worked, and is my child really responding to it? I think that's an important conversation. I'll encourage, from my perspective, if we're really thinking about, you know, starting a cognitive behavioral therapy intervention, it's perhaps the first time that, right, that the child has been seen for a particular condition, then we should know kind of how the child might be responding to that intervention after 4 to 6 sessions. Again, depending, I'm using broad generalities here because I don't know the specific situation. But in about 4 to 6 sessions, you should know whether kids are starting to kind of respond. So do we understand a little bit more about what anxiety is? What are the situations that are triggers? What are some ways that we can start to kind of approach these situations instead of avoid them? And how are we starting to work through doing that? Are things that within those first 4 to 6 sessions that you should start to see some response to. And again, if a child's not responding in that amount of time or starting to show, right, some response to intervention, then that always warrants a conversation from my perspective. Again, this is my own kind of personal practice. But we're thinking about then what are some strategies that are working, and then where are we kind of reaching barriers, and then how are we going to kind of overcome those barriers? Again, depending on the situation, that might be a conversation about, whether medication might be helpful to kind of reduce some of the distress, to make it easier to use some of the strategies. Or it could be that, it's going to take longer because it's really challenging to kind of even talk about some of these things or to kind of work through those. And so it might take a little bit longer to see some of that response. But you should start to see some of those indicators. So I think I would encourage you to have a good conversation with the therapist and your child about, how they're using those strategies and what you're kind of seeing and what are those markers for change that you hope to be looking for. Great question.
Okay, if there are not any more questions, I want to thank you so much, Dr. Kamey. That was incredibly informative, and thank all our participants for joining us tonight. And I'm really looking forward to our time in January.
Sure, absolutely, my pleasure. So thank you guys as well. And again, thanks for sharing the evening and for supporting this conversation. Have a good evening.
Thank you, you too.
Thank you.